I'm I'm going to start the recording. Yeah. So, all right. Good evening, everyone. Welcome to our second segment of the event of our webinar. But this webinar is about pregnancy health and welcoming baby, which is the first part of first part of the this for those who are pregnant. So the next week we have postpartum postnatal care and uh, what's that? And baby's future health. Yeah. So my name is Gong Chun Yan. I'm the founder of Birth Discovery and also the founder of Pay Good Beginnings Forward support group, a movement that I started last year called Pay Good Beginnings Forward movement. And we have our sessions in our private Facebook group almost a weekly basis. So last week we had a webinar on prepare to conceive. So some of you have joined us. Of course, the idea is that to prepare for a nurturing conception without stress. The same thing now, this segment is about stress-free pregnancy and a joyful childbirth. So professionally, I'm a hypnobirthing childbirth educator and a birth doula trained in Good Beginnings. So happen the name is Good Beginnings. So my passion is to inspire parents to take charge of your health and your birth, leading to good beginnings in life as a family. And my dream is that all babies come into this world in joy and gentleness. So giving them a good start in life. All babies should come into this world without birth trauma, ideally, or birth injuries. Yeah. So today with us we have actually five panels of experts today because Red Miller, our holistic midwife, she's on the way to welcome a baby. So which is very exciting. She just welcomed one baby yesterday, and today she's preparing to receive another baby. So it will be your turn, for some of you. So we miss her, yeah, but it's okay. Next time I'll invite her to come back again. We have a few birth workers here in the room anyway. So I would like to invite our friends, our practitioner here, and some of us are Good Beginnings Angels, to introduce yourself. So maybe Dr. Julia, who's a holistic psychologist, would you like to introduce yourself, please?
Hi, everyone. I'm a holistic psychologist. In other words, I not only look at counseling and the psychological and the mental aspects, I also look at the body-mind connection. So my work ranges from working with parents, working with mothers or mothers-to-be or all ages actually, on building a self-awareness and also really finding out their patterns, their own self patterns in terms of how they relate to themselves, how they relate to others, so that this self-awareness extends to what the relationships that they want to create in the world, be it with other people or their children, and also when I say holistic, it also goes into even preparing the body. So what to eat nutritionally that's nourishing for the body, and also tackling things. My particular interest is to help people overcome not only gestational diabetes and high blood pressure, but beyond that, if you have that, then how do you live and how do you pay attention to nutritional factors so that children do not grow up compromised from the very instant because, for example, gestational diabetes, we already impact our own bodies and the child within as well. So how do we carry on the process such that we are aware of that the body already has certain kinds of weaknesses, for example? So So it's a range of it, but my concern is mind-body connection. Okay.
Mm.
Mm.
What's your dream, Dr. Julia?
My dream is everybody comes to their full potential, and that we come to this world, we come to this life not to be agents of reproduction, in a sense that we reproduce things. Like, we do not come here to just like perform a script. We come here to discover something unique in every individual, to be in their fullest potential. So, be whether you're a parent, or you're a partner or something, um, how do we bring out that best unique self into this world? Mm.
Thank you, Dr. Julia. So I would like to invite Haja Mariati, who is specialized in massage during pregnancy, childbirth, and of course fertility as well. And she's also a professional massage trainer. Haja Mariati, would you introduce yourself, please?
Hi, everybody. Can you hear me clear? Okay, good. Okay,
Yes.
good evening. Nice to meet you, everybody here. Okay, my name is Haja Mariati. I think I'm the oldest in this group. I'm 66 years old, and
Mariati, can you speak louder, maybe closer to your laptop, please?
I'm
Sorry.
not using. I'm using my desktop actually.
Ah,
Yeah, that's a
right.
problem here. Just now I asked you whether can you hear me clearly or not. But anyway,
Mm.
at the age of 60 years, 66 years old now, my business actually is doing more wellness. Before that, for the last 30 years, I was being a nurse for 10 years, and then I moved to UK to work as a nurse. From that time, I start to learn about pregnancies and childbirth, and I work um, in the hospital there actually. What happened is it's just a blessing in disguise that I come into aromatherapy with so many segments that I have undergoing. For example, like the segment is one of it is aromatherapy in clinical and holistic massage, and pregnancy and childbirth, labor, womb recovery as well. And the last one was I had attended more into fertility, which is very good for me and to embark into this industry.
Mm. What's
Yeah,
your
I was
dream?
actually, in fact, while doing that, I was a doula. I learned doula, which is very good also, where we attend more direct case studies, so many case studies during that time. And I have been living there for about 12 years. Then I come back to Singapore. Yeah.
Wow. Wow. What is your dream for this group of parents, mothers in particular?
Yes. Being so many years in my practice, I found that as the age is coming up, I I wish that somebody or everybody, even the therapists, whoever, can learn from this, that this training part, especially in pregnancy and childbirth is an age. What I mean is labor as well, and
Mm.
fertility is a niche now in Singapore. Um, that's why I'm start to train people, the therapists who wish to embark in this and to continue the practice.
Mm.
Yeah,
Thank
that is
you.
my, because when come to be a therapist, a good therapist, you must have the knowledge, right? You must have the wisdom, and you have the intellectual and the compassion to to meet this kind of people.
Yep.
If you don't have this, then it's quite difficult to explain and to give knowledge to this.
Okay.
Mm.
Thank you, Haja Marati.
Yeah.
So I would like to invite our lovely birth doula here, who is an experienced mom, Jamie. Jamie, would you like to introduce yourself, please?
Hi everyone, my name is Jamie. I'm a certified birth doula as Ian has introduced me. I'm also the founder of Just Doula. I have a background in physical education and sports science. And I also currently volunteer at Safe Place, and I do write for the Asian Parent. I've got about 15 years in education and 15 years of experience in education and the health sector. And my passion is about all things birth and all things education. Yeah. So yeah, in these two very broad categories, because my motto is to always love the adventure and to venture into love. My dream is for every woman to stay empowered, to keep drawing on their strengths and to find their inner voice.
Oh, beautiful. Thank you, Jamie. I'm looking forward to hear more of your story later. uh, well, pregnancy is a very joyful experience, right? So especially the moment when you find out you are pregnant, yeah. And I always think that pregnancy is a journey of discovery. Like what Dr. Julia said, you discover more about yourself because this is a time for you to connect more to yourself. So before I'm going to start, I wanted to ask one question, and I would like to invite everyone to type your answer here in the chat. Okay, listen to this question. So when you find out that when you are pregnant, what's the first thing you do? Can type in the chat. Once you are pregnant, what would you do? What's the first thing you would do? Jeff or Joy? Oh, yes. Catch it. Oh, yes, yes. Catch my breath. Okay, our panel later, I would like you to speak up, no, not, not just type. Yeah, share with my beloved people. Yeah, beautiful, beautiful. Yeah, what else? Worry? Okay. Go to an obstetrician to confirm. I think prior to that, you already know, huh? What I should do now to take care. All right. So, okay, now I would like our friends, our panel of experts here, our Good Beginnings Angels, to answer those questions. What is the first thing you will recommend parents do when they find out that they are pregnant? At least the woman is pregnant. And anyone want to start first? Jamie, since you're here. You're the last one on the speaker list. Yeah, you're the first one here.
Yeah, on your screen, right, or something.
Yeah, you're right on my screen. So must be you. Has to be you.
I think I like to say that I think most parents start going on a spending spree. They start going on a shopping spree, right? What do I need? What do I go out to get? It becomes this, fascination about, of course, you tell your friends and your family, and they all come in with advice. And, then there's the, let's go out and get this, really fantastic stroller, or what Pampers do I buy, and all that kind of thing. But I think the first thing that, I would really go forth and talk about is that all important conversation about the things that matter, especially your partner and your husband, about how this is going to go for the two of you, because things will change. Things are about to change, and whether you like it or not, it's not going to be the norm like what you knew before. Yeah, so I think that's a really important conversation to have, and to also have with yourself. like, how are you taking it? Like, yes, I know you're happy and I know it's a joyful moment, but there's so much more. Yeah, there's so much more to it. And yeah, I'm going to talk more because there's more people on this panel, but yeah, that's the one thing that I think, yeah, I would
Okay.
say, yeah.
Yeah, really a good conversation with yourself and your partner, right? Yeah, that's true. Yeah, Jamie is a very experienced mom of three. So she would know the first one, the second one, and then the third one comes. They're all different. I only have two. Dr. Julia, would you like to share? What's the first thing
Oh,
you would recommend parents? Yeah, their new parents or experienced parents.
I think for me, the journey is always the most critical one is going back to the question. It's like, oh my goodness, it's like I'm bringing a child to this universe, and what kind of child do I want to raise, and what kind of parent will I be? Actually, there will be that fear and excitement, it's like, what kind of parent will I be? um I mean, I know myself that I have this XYZ strengths and ABC bad traits, things that I criticize myself for. What happens if this I impact my child in certain ways or whatsoever? How will she
No.
turn out? So I went through a lot of that. I don't know whether the people, the ladies attending today's talk, do you relate to that? And what kind of questions do you ask yourself with regard to what kind of, for me, the first question is what kind of parent I'll be, and what kind of impact will I be for my child? But I think the most important, if I were say to give some words of advice, is that ask ourselves, what kind of child do I want to raise in this world? Mm, because then uh, it will lead to many other questions of self-discovery. Yeah.
Yes, Dr. Julia, that's a very big question. Seriously have to think about it.
Yeah.
Thank you for sharing. Yeah. Haja Mareti, Haja Mareti, um, she she has many children, and she's actually grandma, very experienced. Haja Mareti, would you like to share what would be your first recommendation or suggestion for those mother who found out that they just got pregnant, or parents to take note of?
Okay, for me is to explain to them, to start with the birth plan. The birth plans is the 3 trimester of 1, 2, and 3rd trimester. What to expect, especially the 3rd trimester, and then the labor. So at least if you tell them the fundamental of this first, 2nd, and 3rd trimester, then they will understand. And then what happened when during the labor, the contractions, and then the for easy delivery. Yeah,
Thank
so
you.
you have
You
to tell them so that they are aware that throughout the 9 months or even sometimes 10 months, like they don't understand because first time mother, they have a lot of anxieties, there's a lot of fear, and so on, so on. So we have to explain some tips to them.
okay? Yeah, you you think ahead of that until birth. Not just
Yeah,
my
because if you don't tell them, they like,
mm,
because they don't, especially the Malays, or even the Chinese, when it comes to me, oh, I'm pregnant, then I said how many weeks, oh, 6 weeks, 7, or even like up to 20 weeks. So they do not know what to do, right? So
yep.
I have to explain to them this, what happened your this week, your trimester, and what you should do. Sometimes every month or every weeks, every weeks the body is changing, the baby is developing. So if they tell them to create more awareness for them, for the sake of their wellness and the baby as well.
Great, thank you. Yeah, my top list will be bonding, because the moment you find out that you are pregnant, right? A lot of times, it doesn't feel real because you don't have the belly yet. Yeah, especially the first trimester, right? And actually I was pregnant the first time and I didn't know. I was denying. I said it was the yoga. Must be the yoga I did that gave me that sore belly. And then later I found out something is not right. Yeah. So I would say yes, bonding, have a communication, have a dialogue with this baby in the womb, although you may not feel it yet. You know, yeah. So the whole pregnancy is about connecting with the little one inside. You may have one, you may have two. Yeah, just connect with the little one, because all babies want to feel love. They wanted to feel welcome. What would you say to your baby? If you were to have a dialogue with your baby, what would you say to your baby in the womb? Yeah, you can type in a chat so we know. Anyone? Does it doesn't it sometimes it doesn't feel real, until you have a big belly, until your baby is about to come, then you feel real. And I think some of you do it's gonna be a fun ride. Yeah, okay, yes. So I think there are some people who are feeling quite stressed over pregnancy and not knowing what to do, just like Haja Marati mentioned earlier. But if you're not sure what to do and not really connecting with the baby, it will be quite stressful. So um, our friends here, maybe y'all can share what's your way of helping or suggesting to these parents to reduce the stress levels. Now, when I say stress, I refer that to mental stress, emotional stress, and even physical stress. Do you all have any suggestions? What would be your suggestions? Anyone want to give it a go? Dr. Julia.
Ah,
Dr. Julia,
reduce stress. Actually,
Uh,
I for my own birth, for my own conception, when it was 2 weeks, so I don't know how to relate to thinking it's not real, because I actually feel it very, very, that the presence very strongly, even though it was
wow.
just 2 weeks. I knew that
Wow.
she was there already, and I know it's a girl. It was crazy, but I already knew, and it was the knowing was so acute. But anyway, um, it was a when I if there's any stress at all, it would be not burden, the the knowledge of that you're really having another life inside. So it's kind of like a magical time. And if there's any stress, it's really about, for me at that my what I went through is that really the parent is how much of a parent I will be, and so on. So I would think that, again, Chunyan said it very right. It is above discovery, it's a journey. So for me, I would really get out there. I wanted to talk to my mom, talk to my mentors in life, to explore this concept of parenting really. I think to explore this concept of parenting, what really makes for good parenting for me, and also to know myself, is also a time to discover myself. Because through that experience, when I was 30 when I had my number one. So really knowing myself, who I am, and what is important to me. And also, I really want to challenge all of you to think a little differently here, because I know that a lot of you might be thinking, oh, I want to be a good parent in A, B, C, D in this sense, and I want to impart these values and that. I want to create a human being who is X, Y, Z. A lot of ideals for this little one. I wonder how she or he would feel hearing us and our hopes and dreams and our envisioning of what we want to create. But beyond that, really, have we ever thought about this life as a very unique individual also before all the imposition? It's like, so I think the most healthy question to ask is, what kind of parent will I be? And why am I having this child anyway? Why am I having this child? Why do I want to bring another human being to this life? And when I think that those are very pertinent questions, because the through the I think Jamie can answer, Chunyi, and also many children out there. When the children come before you, they are not only people to be molded into something. We are really interacting and connecting with them as unique individuals. So who we are at every moment is, and how well we know ourselves is really the base where we start with. So for me, the birth process straight away, the inquiry inside about who am I, how well do I know myself? Because what I know of myself will impact the child, And now looking back, indeed, if I'm if I'm clearer about, actually, I must say I went through a lot of introspection. I know my weaknesses. So I say, in relation to that, maybe I would do things a certain way. In relation to my impatience, for example, I can get very excited and impatient sometimes. So what kind of parent will I be if I come to her with my expectations, for example? Mm. The first time I encountered my own impact on my child, my impatience and my high standards, is when she was 4 years old. Before that, I don't know what oxytocin did to me, but I was really like a very connected mother and very attached mother. And it's only when she was on the piano stool learning a song, then suddenly there's this crazy tiger mom that reared up before me, like suddenly so impatient. Why is it that she's not getting it in a certain way? And I saw myself coming out with my character at her, and she looked at me. This suddenly the mom coming out of oxytocin, and she actually gripped her heart. She literally gripped her heart when I was coming at her in a scolding manner. and it suddenly impacted me that, oh, okay, that was the very first instance that I know I am, my character is showing up, my expectations, it was showing up. But that was 4 years old. I tried my best already. I tried my best to be very consistently loving, and oxytocin helped, the hormones helped. But then later on, I had to be more and more conscious about encountering myself and her and who she is in the world. Okay, so that's my little story. But even though but that whole encounter with your child begins much earlier than that. It's the very moment she's already in your life that thinking about who I am, how am I going to impact her, what kind of parent I will be is key.
Dr. Julia, it is very true. Yeah, and that's where the stress. Yeah, it's a lot of reflection, right? I think that's what you mean by knowing your own personality. How aware are you, your strengths and your weaknesses, and work on that. And that should start now, huh?
That's why I came up with a model for connective parenting after that. I don't know, maybe later on when we have a bit of time, I'll share it with y'all.
Yeah.
Yeah.
Right. Thank you. Thank you so much. Yeah. That's yeah, a lot of insight here. So, anyone else would like to share a little bit about what's relate to what Dr. Julia just mentioned? Jamie. Jamie has a voice.
Yeah, I have too much of a voice, and I think that's what Ian knows.
I'd like to hear your voice.
um, I think I can relate to what Julia just said. I mean, for me, it was a trial and error. Like I had 3 times to try, right? So, so yeah, the first one, it was, I guess because of the way my mom birthed me, and the story that she told me since I was as soon as I could understand what happened. Yeah, so I really accepted pregnancy as a natural thing. Like it's a natural course of life. But whatever I do has an impact on the life inside me. Yeah, from the very start. And I think the important thing to me was to uh, I won't say remain happy, but just be very conscious of what I do, what I say, my actions, and I think the awareness, you know, how my body's going to change, how am I emotionally prepared for that? uh do I know everything? I mean, yes, I was a biology student, but that doesn't make me
Mm.
prepared for pregnancy. So I think it was about reading up, and yes, stresses play a big part, for sure. Like I said, your life does change, and you do feel that life inside you. Yeah, however small, however big your belly, you still feel that there's something inside of you, right? And I mean, your hunger alone tells you that it's not just you. And yeah, I started to reach out for books. Yeah, and for knowledge. I was really hungry for that because I find that you get stressed when you fear things during pregnancy. Whatever your fears are, it could be physiology wise, it could be emotional stresses, it could be anything. But the truth at the heart of it is that if you actually get into the essence of what is it that's stressing you, right? I'm pretty sure that if you actually pursued that knowledge, and got to know a little bit more about it, even if it's not in a book, right? And you went into a journey of self-discovery for just a little bit, I think it would help to ease that stressor. And those stresses could also be from your partner, like maybe you're not sure about how your partner feels about this pregnancy, or maybe you guys are not communicating as much because both of you are thinking like, okay, he thinks that way or she thinks that way, and then it's like, oh, I'm reading your mind and he's reading my mind, and then it becomes a lot of miscommunication. And that's where I do tell my clients that actually pregnancy and birth is all about communication, because your body is communicating within itself, and you are communicating with your partner, and you're communicating with your family, your parents, your siblings, those who are close to you, your loved ones, your friends. And then if you want to go into the technicality of it, you're actually communicating as well with your team, your medical team, your birth team. And all of it is so much communication going on. Your hormones are talking to each other, your brain is talking to your body. There's so much going on, and your heart, your emotions, your sensing of things, how you see the world. There's so much going on. So I think it's really to get in touch with what those stresses are and come down to the root of it. Yeah, so that's my 2 cents worth.
Thank you, Jamie. Communication with, don't forget your babies. Communicate with the
Yes.
baby.
No,
Yeah.
of course. No, I'm just saying, it's within your body and everything. Yeah, of course.
Yes, exactly. Yeah, I hear you. I totally agree with you. Yeah, Jamie, share with us. I remember that you have a very young baby, but what motivates you to become a doula when your baby is still quite young?
Oh wow. Okay. The spotlight is suddenly on me today, huh? Okay, right. Okay. So
It's all yours.
So okay, so my first when I first got pregnant, I really was into this whole having a birth plan, and that was this is 2011, so that was a good 11 years ago. And in Singapore, birth plans were not the done thing. Like, you know, you go to a doctor and you ask for a birth plan, but the doctor looks at me like, what in the world are you talking about, right? And I had a birth plan. Like I knew what I wanted, and I knew exactly how I wanted, or exactly how I saw certain situations to go. And the first warning signal should have been, you know, when he said, no need lah, you know, he just said, no need lah. And I was like, oh, okay. And I went home and I thought about it, and I was like, okay, let's forgive the man. You know, he's got good bedside manners. You know, my husband loves him. You know, he takes the time to answer my questions anyway. You know, let's just, you know, give it a go and just go with it, right? And then lo and behold, on the day of, you know, birth, actually my baby wasn't due to come until another week later. I mean, if we follow EDD dates, which is not what we should do, but yeah, anyway. So being a first time mom and all, I'm like, okay, baby's not due for a week. So we went out for a date. And the taxi driver flew over a hump. And my water bag burst because of the hump, right?
Oops.
And it was quite a bad jolt. And the minute I came home, there was this gush, right? And we all know, we watch this in videos or movies, right? And it actually happened. And I was like, oh Lord, right? What's happening? And my husband was panicking. And we went into the hospital because he was like, no, let's just go in, because, you know, this is the first time we're doing this, so let's just go in. And I went in, and then there was, you know, suddenly I was changed, right? So I had to come out of my home clothes. Then I had to get an enema, and I had no idea that, you know, this was going to happen, right? And then, you know, one thing led to another, and then, you know, it was like this sales pitch, right? From the you know, the laughing gas to the, you know, the injection to the, you know, what was it? The epidural. Yeah. And I just kept going. It was like I was high on drugs, right? Happy high, right? And then, you know, the episiotomy came, and I was like, what? Okay. So everything that I planned in my birth plan just wasn't, yeah, it just didn't happen. And after I gave birth, I expected myself to walk, but what I forgot was that I took the epidural, so they don't allow you to, you know, be on your own or to bathe or anything like that, right? And I felt so helpless because the nurse even scolded me for like getting out of bed, because I really, like, you know, I had all this strength in my arms, and I was like, no, I am going to shower. I am going to shower because I feel so grimy right now. I don't feel good, right? Yeah. So all of that was just like, no, this is not how my mother told me it was going to look like, right? So fast forward to the second birth, and I actually had a natural birth. I had Emma. I think Yen knows who Emma is. I had Emma as my midwife by accident, and I changed my gynae. And it was such a fantastic experience without the epidural. And I was like, wow, you know, this is what I wanted, right? And from day one, Dr. Ike Tan, he was my doctor. He sat down with me. He said, "Do you have a birth plan?" I was like, oh, he's asking me for my birth plan. Wow, this is such a change. And yeah, it was just so, you know, it's just so different. And on the third baby, sorry, I know this is a very long story, but anyway, on the third baby, he was doing my ultrasound, and then he said, "Do you want to become a doula?" And I was like, "What?" Yeah.
He asked you.
He asked me.
He asked you.
Yes, he asked me, "Do you
Interesting.
want to become a doula?" And I was like, "Why are you asking me this question?" Because I had worked with him in NUH
You got a
previously.
message.
Yeah, and I was like, "What? You know, I have a full-time job, and you know that, right?" He was in private practice. And then I said, "Okay, no, hang on a second, right?" So he goes, "You know, let's do a water birth. You know, let's try it." I was like, okay. So we went for water birth, we did all that. And I went for the doula course. I was like, okay, let's just try it out, right, for size. And I loved it because of the physiology of it all, the biomechanics of it all, it all made sense. It's like, when you talk about your brain, your mind, getting into all of it, right, including your physical being. It's just it's a holistic experience at the end of the day, right? And it just got me going. I was like, mothers need to know this, right? So yeah, and I think that was the journey. So I consider my births trial and error.
Mm,
uh
yeah.
Unfortunately, my children took the brunt of it, but yeah, because I was trying to get better at it and they were like the guinea pigs. But yeah, yeah, that's how I became a
Mm,
doula, and I really really have the passion for it. Yeah, because if moms don't know what's out there, I think
yes.
they're less empowered. Yeah, so I took too long.
I
That's a good
really
one.
hope that I had someone to guide me when I went through, because I also had my water bag burst early, but she came so long. She took 12 hours to come.
It's
And
normal, Julia, Dr.
yeah,
Julia.
I
It's
know.
quite normal.
And again, the cocktail of selections, laughing gas to all the way to epidural and all that. And I chose epidural, but nobody told me that my epidural didn't work. So
Yeah.
so it
So,
was crazy. So I'm
mm,
not going to scare all of you. I'm just saying that it's it would be good if, like a dear mother who's very knowledgeable about something. I see the doula as somebody like that who can guide through the whole spectrum of what to expect.
mm,
That would
yes.
have been so much better.
Yeah. I would say first
Mm.
prepare your
Yes. Oh my
mind.
gosh.
And
Yes.
yeah, yes, yeah. Not forgetting about childbirth is all about it is a breakthrough a journey of breakthrough for mother because part of the hormone is also fear hormone. We always talk about oxytocin, huh? Oxytocin high. When the oxytocin is high, something else is high as well when it comes to the birth. So yes, first prepare. So when you know yourself, you will learn to empower yourself because empowerment comes from within. Yeah, and you know what to do instead of the child will be a guinea pig. Well, whatever you do have an impact on your child. So if you know yourself, then you can avoid all these lessons. So we are experienced mothers, and some of us we learn from our lessons, and but that's already happened. So how the child is born will shape who they are. So there's no second chance. Yeah, and, unless you go for a rebirth experience to clear some of the junk. Yeah. So yeah, it's good that some of you are exposed to this. Yeah, it is so important that how we come into this world and it's how we see this world. So if the baby come into this world in a very gentle way, in a very joyful way, when you enjoy your birth, your baby enjoy coming into this world. That's what something I always say. Yeah. So let's come back to pregnancy. Yeah. So Dr. Satyam just came in. Yeah, Dr. Satyam, welcome.
You, thank you.
Yes, Dr. Satyam, we have gone through a round of introduction. I would like you to introduce yourself to our friends, our audience here. Just share a little bit about you.
Okay, so I'm Dr. Satyam. I'm a practitioner of integrative medicine with yoga and Ayurveda as the main science which I use for my patients. I've been practicing in Singapore from past 10 years. We have three clinics in Singapore in three different areas, and we work a lot on pregnancy and preparing the mothers if they have failed IVF or IUI. On the other side, trying to give them more support in case there have been recurrent chances of miscarriages, etc.
Mm,
So we are trying to do our best so far. That's all.
yeah, good, good job. Yeah. So, Dr. Satyam, so this segment is about pregnancy health. Yeah, particularly I know your specialty is to help women, pregnant mother improve their health during pregnancy. So what would you recommend for expectant moms to keep themselves in a tip-top condition during pregnancy to prevent to prevent preeclampsia, one of the common health conditions towards the end of their pregnancy, and of course gestational diabetes is one of them, or small babies. Would you like to share a little bit about that?
See, pregnancy is not one day work, which you all understand as well. So it's nothing new for you as well. But when we talk about problems in pregnancy, so every week or every month there is something new which is happening. Like week number 12, the heartbeat is functioning better. Then week number 18, the neurons multiply by 250,000 neurons per minute, and so and so forth. There are many changes which are happening, and based on these changes there are risk factors also which are involved, you know. Initially from the very beginning, the malfunctioning or misformation of the fetus can happen. If not that, there can be sometimes genetic reasons, or sometimes there can be physiological reason, because of which we say that the Singapore Health Ministry data says that every third woman has gone through miscarriage in Singapore. So that's a very weird and very saddening data, but that is the fact today. You know, after that, once the mother reaches to week number 20 or week number 21, so we can get intrauterine growth retardation or global development delay, or we can see them having gestational diabetes or pregnancy induced hypertension, which can lead to eclampsia or preeclampsia. You know, so uh, it's it's very much subjective, like which month and what, where the mother comes to me for help, you know. So depending upon, let's say if the mother comes to me on 23rd week, where nails and toes and bones are forming, so my work at that week will be to make sure that how I can give different kind of practices and different kind of nourishment, food, diet, supplement, and whatever can be done in the form of yoga and Ayurveda therapy to make the bone stronger, because that week she came, and that week is the week for development of the bones, you know. Because what we see today is people are getting osteoporosis, they are getting arthritis. Somewhere from the beginning things have not been taken care, and the speed of metabolism and the formation which is happening at the time of infant age is the best. You know, everything is developing, you know. It's like developing the roots. So if the roots are developed better, then we can do better. Let's say the mother comes to us on week number 16, where neurons are developing. You know, we live in the country where mathematics is the backbone of the country, you know. So, and every mother wants the child to be good on in maths, right? You know, and then later on when the neurons are not enough, we say that how come my child is so duffer, you know. So it's not, and then the child gets scolded and there is a lot of pressure on the child. But to me, what I tell to the mother is, it's not your child's mistake, it is your mistake. Because if you are responsible, you need to be responsible on 16th month, when the neurons, sorry, not month, week, 16th week, when the neurons were developing with the speed of 250,000 neurons per minute. And that was the time when you should have done certain practices or certain food or diet which might be helpful for the development of the neurons. Because after the baby is born, there is no new neurons development. We can only strengthen our nervous system, but we cannot make new neurons. So week number uh, 29, when the ovaries and the testes are getting developed better, you know. So we talk about today that okay, there are men who have low sperm count, there are women who have low follicles, less follicles. Question is, you are also pregnant now, you also have a child. Week number 29 is the development of gonads. So you had the problem of less sperm count or ovarian problem. Are you doing something for your child? Are you enough responsible to do something in week number 29 so that your child should not have less sperm count or your child should not have less follicles? You know, and we have all those practices. It's not that someone is inventing something new. It's very simple, very common. It's more about how much you have knowledge and how much you are aware about doing things, right? So to me, it's like this is all about management and being aware of health system and being the part of it seriously. Every week is important, every day is important. These 9 months of pregnancy, 40 weeks of pregnancy are never going to come back for that child. You know, it's once in their lifetime, which decides their future. So that's the way I guide, and I like to guide my patients psychologically, being positive. But that's important, but that's not enough. You know, that's very, very important. If we talk about percentage, 50% of the time your positivity is the one which is going to heal. So it is 50%, but remaining 50% also we need to work, we cannot ignore. So completing mind body medicine is the final concept. Yes, yeah.
Yeah. Yeah. Thank you, Dr. Satyam. We have just touched on that about reflecting on ourselves as parents, the kind of stress um, and that kind of expectation we have. So whatever we do as a mother directly impact the child, and it's so important to take care of of course, emotional health, mental health, and physical health. So everyone, just let's take a deep breath. Yeah, take a deep breath. You can close your eyes and take a few more deep breaths and first de-stress. When you breathe out very slowly, yeah, breathe out very slowly, quiet your mind and body. Always remember to connect with yourself. Yeah, feel your body vibration. You may be able to even feel your heartbeat. You may even be able to hear your heartbeat. Just come back and connect with your body. And if you have a baby in your womb, connect with your baby, bond with your baby. Always remember that you have a baby in the womb. And that baby is not lonely because baby has you, and you are not lonely because you have baby. You always have baby with you. Yeah, okay. Very good. I would like to ask one more question to Hajam Marathi. You may want us to speak a little bit louder because we can't really hear you, Marathi. Um, we would like to talk about how you help women, mother prepare for the birth. I know that many moms ask me this question, and they were worried about perineal tear. They were worried about the healing in the private part. So would you like to share with us a little bit about how you prepare women in labor and birth?
Okay. For this pregnancy, late pregnancy, can you hear me? Because I think my speaker is not good enough.
It's okay, just speak louder.
Yeah, but
Okay.
I
Yeah.
can't shout.
It's okay. Now you're okay. Yeah, you're closer to your laptop. It should be fine.
Oh, okay. That's good. Okay. Most people, they comes to me for this the late pregnancy. But usually, I tell them if you want to start with something natural, you want to avoid from episiotomy or anything, then we have to start with 34, 35 weeks onwards, so that the elasticity at the vagina can be more loosened. What I'm talking is about perineum massage. So the perineum massage, what I'm doing is usually beside the full body massage, I'll give them a hydrotherapy so that it helps to loosen and to relax on the whole body system as well as the baby. And it takes about maybe like 30 minutes for them to enjoy the hydro. And then we work on the body to lose all the tension, the stress, and to do the lastly will be the perineum. So the perineum massage is very rare. My clients outside there, new mother, aware about this perineum, but then there's a lot of good awareness that I have to give to them. So that is what happened to avoid from episiotomy. Maybe for cesarean,
Transfer to the
avoid from
laptop.
cesarean,
Malati. Kita dengar.
avoid from cesarean, because most people they don't want to have a cesarean, right? And they don't want to have epidural,
Zero, yeah.
even anything that is medical intervention.
So you do a certain massage, right, to help for the labor. What do you see commonly in modern women now in terms of their ability to birth the baby naturally? So when you massage mother to prepare for labor, what's your finding?
Well, for them, the woman or the mother usually, number one, I think they want to experience this perineum, but initially when the first sessions can be very hard for them because of the pain that they can endure. When you work into the vagina, the perineum massage, the perineum muscle as well, and can sometimes can be touched into the clitoris as well as the rectum, but that is the experience that they need to undergo. But of course, when it's too deeper, then we have to cool down, that relax, so that they don't feel so sore.
Can a husband help?
Huh?
Can a husband help?
Yes, usually I ask the husband to come so that he can do it every day or alternately days for the husband to do the wife, the vagina. Yeah.
Okay, great. Yes, that's something a lot of people are aware, huh?
It can be embarrassing for the woman, and the husband also like so shy like that. But then I have to motivate them to be more, I would say, daring enough for towards the wife, and of course to do at the same time to do the bonding.
Yeah, it's a bonding between the partners, husband and wife before baby comes. Yeah,
Sometimes
that's great.
nurturing also very important because when it comes to like that, at the end of the day, when the mother or the wife got contractions, the nurturing becomes very important.
Yeah, for perineum massage to get to know their body, right?
Yes.
And a lot of people are quite fearful about this part, so they are not aware that they can do it. They can do the perineum massage, and actually doctors may not even recommend it. They don't know about it. That's the benefit of that perineum massage. And of course, a lot of massage therapists don't do it. That's why, yeah, and they don't know how to do. Unless I teach them and you teach them.
Yeah.
All right. Okay. So we have come to a segment, 9 o'clock now. I would like to invite all our friends, any mummies, parents here would like to ask questions. Now it's an interactive part. This is your chance to ask questions. Do you have any questions? You can unmute yourself. Priority to those who unmute yourself and ask first.
I see a question. Are squats useful for natural birth? Lynn, thank you for your question. Yen, you want to take that or
Go ahead.
okay?
Jamie, go ahead. If you read
Um,
it.
Squats are actually quite beneficial, but it really depends on what kind of squat you are talking about. There are different kinds of squats where you have your knees facing inward and your knees facing outward. It really depends on what the position of your baby is in, what station he's in. I would personally feel that deep squats are good, right, to bring baby down because of the gravity. Towards the later part of labor, I like to recommend that women actually have their knees bent in and squatting, yeah, because then it opens up the pelvic area, yeah, the pelvis, yeah, that's what I meant to say. Yeah, so squats are good. Just remember that you should have support, very firm support. Get a rebozo if your arms are not long enough. Yeah, and make sure that your man or your partner is braced for that squat. That is very important. Yes.
Yes,
Yeah.
yes, very good. So you can answer the next one as well. Marina has a question. If you don't feel comfortable with the perineum massage, what about Epino?
Yes.
We talk about that, huh, Marina?
Yeah, I was going to actually ask Mariana, what about the Epino? Because I've had clients being recommended to use the Epino by options. So
Yes, yes.
yeah, and it's worked. It's actually worked.
Yes,
So
yeah.
yeah, I was just going to ask. Yeah.
Mm. Epino, I just touched on that in the class as well. So if you're not comfortable using doing massage, the perineum massage, the Epino would help. And one thing with the Epino is that it acts as a stimulation. It acts as a stimulation for you to birth the baby, because when you inflate it feels like the head of the baby is in the birth path. We call it birth path. Yeah, so you would feel, the baby is there and how you utilize the muscle to birth the baby out. Yeah, and now this Epinol Plus costs about 189.
Yeah, it's not cheap.
Yeah, it's not cheap. If you plan for a few more babies, I think it's really worth it. It does prevent tear, that's true. But before you do the Epinol Plus massage first, because Epinol Plus you should not do it before 36 weeks. So you can only do it at 36 weeks, because it may also there may be also a risk of trigger labor to start. Yeah. So
And also like to add that relaxation is a very important part, whether or
yes,
not you use the Epino or you do a perineal massage. Because if you're
yes.
not relaxed, then it's just not gonna work. In fact, you're gonna feel more pain than anything. Yeah.
Yeah, it's perineum massage is about doing it right. It's not about just doing. That's more important, because evidence shows that it doesn't work, but there's also evidence show it works. Yeah. So the question is how. Yeah. So if you want to learn how, you know who to reach out to. Yeah. If you don't know, you can approach me. I'll direct you to the right person.
This
So
perineum massage.
mm,
About the perineum massage, one thing that when I do the perineum massage for my clients, I always emphasize with them that, okay, if you are in the labor, yeah, um, you don't have to lift up the butts, especially the butts. When you lift up the butts, the doctor will do the to them. The important is not to lift up the butts, because why, it's naturally the baby will give ways, there is the passage, because when we do the perineal massage, we loosen all these muscles, vaginal muscle as well. So when you lift up the butts, then the doctor will cut the what I would call it, the perineum.
the episiotomy, yeah. There's something we wanted to avoid here, not to get cut. That's why we will suggest the perineum massage.
Yeah. And
It's
at
so
the same
important to
time,
have the perineum massage.
we will do the massage at the pubic area. yeah, so that the ligament can be extended, can be stretched, so it helps the moms to push more effort for the baby to come out.
Yeah.
The
So
sometimes the pubic area is not balanced, sometimes it's not balanced, some up and down, so the baby cannot got stuck at the pubic bones. So it has to be aligned, and the ligament at the center can be stretched at the same time, so the baby can move out. A lot of alignments we need to do. For example, that the pelvic bone also have to be aligned. The legs, the ball on socket has to be aligned, so that when we do the perineum, the stretching at the perineum muscle below can be easily relaxed.
Yes. Yeah.
So that is the practice, our practice that we are doing for this perineum. Of course, if they have the gym ball, they can use the gym ball. If they can do exercise, squatting, or go up to the staircase, down staircase, so it helps also.
Yeah. Perineum massage actually is really beneficial for those who wanted natural birth. But like you say, relaxation is always the key. Yeah. So the massage itself also can help the woman learn to relax. Yeah. So in terms of childbirth, it's all about relaxation. You don't have to worry about whether you are we don't worry too much about taking pain relief, because your body has the ability to equate with these surges. We call that surges in labor. So it's a natural relaxant that you can tap into, endorphins, which is 200 times more effective than morphine. And I have upcoming talk about hypnobirthing if some of you are new to this idea, to learn more about mind over body approach. So if God gives you a baby, trust that you can do it. You gotta believe you can. Have faith in yourself. Let's come back to any more questions that you have, or anyone wanted to share anything in this segment. Jamie.
Sorry, I just wanted to answer the second part of Lynn's question, because she asked again
Yeah.
about when to do squats. Lynn, as I'm coming to you as a physical educator as well. So I would say that, squats are actually a very good exercise throughout your pregnancy, to strengthen, your glutes and, your thighs and all that, because you do need strength when you go into labor. But don't overdo it. As with everything in moderation. Yeah. So if baby is not in an optimal position at in your third trimester, I would say that deep squats may not help. Yeah. But do your squats. It's fine. If you've been one to do squats before you were pregnant, that's fantastic. Keep doing them. But yeah, during labor, yes, squats are good. If that's the whole of your question encompassing. Yeah, I can send you information about squats if you're very interested. I could give you a little bit of evidence. Yeah, so that's fine.
So with lean, you got to be aware of your own body first. Yeah, if you have some weak muscle misalignment, you need to know your limit. So whether squat is good for you or not, and how much can you do? Yeah, it's always come back to your own body. Yeah. So if you have some misalignment, you have some ache and pain around your hips, you will need to be more careful about that.
Yeah, with every exercise, as with every exercise, alignment is important. Yeah.
Okay, this I think for Haja Marathi. How long does the perineum massage? For how long does the perineum massage keep lasting?
Actually, you can start by 34 weeks, 34 weeks or 35 weeks, and of course you can do alternately day to do the massage, perineum massage, up to through labors. 34,
Question
from 34,
is
35 weeks onwards.
yeah. Malati, the question here is that if she do it for like 12 hours before the birth, does it still stay
No,
elastic?
it's because sometimes the muscle can be so tense, so you have to start earlier rather than last minute, the 12 hours before birth, because you do not know when you want to give birth.
Yeah.
Right. So the labor is can tell you whether you should to go before that, like 34, 35 weeks start, so that it's more elasticity, not only at the vagina but the muscle as well below, as well as towards to the coccyx bones and the butts. So the whole things you need to be addressed to be more softened and to be more relaxed. Psychologically, there will be slight pain, but you can endure, you can find that relaxing the perineum muscle is good towards through the labor also. Cannot like last minute.
Yeah. Okay.
Last minute, how you want to do?
Yeah.
I mean,
I hope you hear that Haja Malati's answer, not last minute, but you should start doing it on a regular basis. Yeah. But if your question is about how long it lasts, right? In terms of the elasticity, if you have been doing it regularly, then you should still have that elasticity.
yeah, but
Also
if you do
depending.
every day, the elasticity
Uh,
will be
mm,
maintained. See, it can more better lah. You see, become bigger, more loose. You will say that.
yeah, very good. Anyone else have any questions? No. Okay. So for our friends, experts here, if I would like you to share with us what's your top three recommendations for pregnant mothers or the couple. What's your top three things you would recommend? I want to start first. Dr. Julia, are you ready?
Top three. Well, I was just thinking that it's a very, very busy time. So many things must do, could do, so many things for the couple and especially for the mother. And to keep yourself really settled and stress-free is very important. I already said that, it's important to use this period to discover who I am, what kind of parent I want to be, and also to keep yourself stress-free, you can actually make use of to learn a skill like meditation, or if you want something, if you don't have time for that, I would recommend that maybe you can try this that neurofeedback therapy called emo wave, where you have your own customized sound wave to listen to. It will also help you to understand all about your character and your profile and your stresses and so on. That I found very helpful to me because I can listen to the sound wave the whole day through. It actually entrains yourself to be the best version of your expression. So that we can use tools like that to help us stay in the best state and in the clear state.
Mm. Okay, thank you, Dr. Julia. That's very helpful. We some of us are trained in hypnosis, deep relaxation. But the tools can help. Yeah, especially when you sleep. No one is talking to you.
Yeah.
I'm waiting for my turn in September.
Yes, Jamie, your turn now. Yeah. Yeah, I think I forgot to ask you one question about the your new finding. Birth in Singapore, the old days. Maybe you can share a little bit about that.
I can. I mean, I'll just give a little short one because
Just a short one.
yeah, my I think when as I was doing my doula work, I realized that a lot of mothers don't realize how much their birth story plays an important part of our culture. and I was actually talking to a lot of, ex-midwives, 88 years old grandchildren, they were like KKH ex-midwives, and they would tell me these stories about, them carrying a lantern, going to the old Sentosa, which was Pulau, is it Pulau no, Pulau Belakang Mati, is it? That's what they call it. I can't remember. But
I don't
anyway,
know. Lilian.
yeah. So they would carry the little lamb and they would go, and the mothers would know, that they're on their way, and they would go there and they would do, all the preparatory work, and they would teach, stay and teach mother how to take care of baby after that. And it was, it's just amazing. We've got all these stories and they're all hidden, and it's so important that, I just want all the mamas here today, or mamas to be, to know, right, that you're actually a very important part of a larger tapestry of birth stories. That we tell a lot of Singapore stories, but we don't tell enough of birth stories in Singapore. And I just want you to know that you are a part of a larger, strong, empowered community. Yeah, that, you are not alone, and there's so many like you out there who would be able to share their stories with you, and you can learn so much from them. Yeah, so I just want to say this. Yeah, that's it. Thanks, Ian.
Hey, Ian,
was
that's
so-
your next impetus for discussion, isn't it? The sharing of birth stories, such a great initiative.
Yeah, I have a lot of beautiful birth stories, inspiring birth stories to share. I always share that in my class, but on the 19th of March, so y'all can join me. Jamie, are you done with the top 3 recommendations?
I talk too much already.
That was our friends are waiting to hear from you. But it's well said. I think you have spoken part of it. Yeah. What's your top 3?
my top 3 wishes, is that the one?
No,
Or you
your
want-
your top 3 recommendations.
Oh,
Anything that you suggest for pregnant mother, whether about the pregnancy or childbirth.
okay. Like I said, communicate, right? Reach out for help, be very aware of what you're feeling, the fears you're having, all those, just pay attention to it. Nothing should be pushed aside, because you are important. You're a very important piece of this, every single part of you, right? That is something that I would say, as maybe my top 2. Yeah, the probably the last one would be, if you can, go for a birth class. Yeah, go for a birth class. Choose one. If hypnotherapy is not your thing, go for Lama's class. Go for something, that will help you to understand the science behind pregnancy and birth, because I promise you, it is a natural process that anybody can do. You just need to know more about your body, and it's miraculous the way we are built as women. I'm sorry about the men here, but yeah, it's miraculous the way that we are built as women, and we just need to know that inner strength. Yeah. Okay, that's it.
Thank you. The gentleman is very much aware of this, and we can learn a lot from him about our body. That's for sure. Haja Mariati, what's your top 3 recommendations for our friends, our strong woman here?
Usually, I can say most new mother are so stressful with their
Oh,
work.
can you speak louder, please? We can't hear you.
I have to be very near to the desktop here.
Yeah.
Okay. For me, I find that new mother is very stressful with their works and their children as well, if they have children. So I recommended them is mostly more to reach out to therapists, how they can help her during this pregnancy. And if possible, if the therapists are well practiced in this pregnancy and childbirth, look for something that how you want to be more relaxed during the pregnancy, because this pregnancy is something that you need to know on the stressful, the emotions, and as well as the hormonal imbalance. So the recommendation is go for massage. Number one, why I say massage is because we are working on the anatomy of the human body as well as the baby, and of course the massage helps in aromatherapy, because I'm specialized in aromatherapies. I find that it's all natural. We don't use any medicines or medicinal, all natural herbals, flowers, seeds, and so on. That can help the woman to holistically, I would say, well maintained, especially during that pregnancy. The massage can really help. And of course, if they have problems with other matters like mental stress or even emotional stress, or even this aromatherapy can help, as well as any complications pregnancy like low placenta, breaching babies, or other case on the health part. So
Okay. Thank you,
of course, to
Ajamati.
reach out to who is good on this partner, this topic.
Okay. Thank you very much.
Yeah.
Dr. Satyam, are you ready for to share with us your top 3 recommendations for these women and families?
My first recommendation is there is nothing impossible,
Yeah.
just that it is all about our will, wish, and awareness. You know, so don't lose your awareness and uh, keep striving. There is a solution, and look for a solution properly. Second thing is it's all about being happy and enjoying those months or those weeks, because as I said earlier that it's not going to be repeated again for the same child. So every day is important, every week is important. So like sometimes you are supposed to go and see Dr. Julia, or sometimes you have to go and see Young Kong. So uh, it should not be like, okay, this week I'm feeling lazy. No, you are wasting 1 week of your child. It's not, you are not wasting your time, you are actually wasting the time of your child, and those the time is not going to come back. And third thing is, no matter whatever the are the things which are supposed not supposed to be done, which is contraindicated, you know all those things should be taken really seriously. you know uh, Alcohol, drugs, cigarettes, along with that, overconsumption of sugar, overconsumption of salty things, and overconsumption of fatty molecules, all these things do create problem and ultimately leads to complications. So take care of that. A small amount of movement is always healthy. Not jerky, not heavy exercises, but small amount of general walking or practices are very much recommended, because it increases the blood circulation in your body, and that makes the health status better. So that's all is my recommendation. And if anything is coming in your mind and which gives you a kind of probability of something going wrong with your health, please talk to experts. you know don't assume and get stressed. Talk to experts. Some experts are psychological experts, some are medical experts, some are physiological experts, some are holistic experts. So talk to the experts and uh, be healthy. That's all.
Thank you, Dr. Satyam. Yeah, I'm always amazed by your work. It is very true that just focus on finding the solution. Nothing is impossible. We have so many miracles, huh? Connect with me. I'm a connector. So I will connect you with the right person, right practitioner to help you improve your health so that you can have a healthy child. Because we all have a common goal here, which is to help you to improve your to help you to help your baby to improve future health, better future health. My top three: first, bonding, connect with your baby as baby wants to feel love, and that you want to feel love as well. Yeah, you'll be more joyful when you connect with your baby. Second, train yourself, learn to relax. It's all about relaxation. It's not about your pain threshold level. Yeah, throw the epidural away because your body can produce endorphins. It's all about mind over body. Have faith in yourself. Train yourself to relax. Train your husband to relax. Your partner. Okay. Of course, when you train yourself, you train your baby to relax as well. So my number three is take charge. Take charge of your birth. Make sure you make a decision out of love, not out of fear. And non-stress. Relax and enjoy your pregnancy. Yeah. Before I end the session, I would like to present to you my voice, representing voice of baby. I'm going to read out to you. This is a poem I wrote last year, and in the shower I realized that my voice is actually voice of baby. I don't speak for parents. This is the second part. Yeah. Womb, voice of baby, will you hear the song I sing? Womb is my world. Darkness is my friend. Brightness is my joy. My world is not a quiet place, but a place I feel safe. My world is filled with rhythm of symphony and drums in nature. Love and joy is what I desire. I can see and feel, so excites me with my senses. My world is pure and conscious. Continue to keep it clean. I'm open to receive only food that helps me grow. I'm comfortable in my home. Should I enter the tunnel when the other world is unknown? I'll reach a point where there is potential for me to grow. Courage is what I have. Do you feel the same? I deserve to be born healthy. I may come out slippery. Please receive me with care and gentleness. I may come out fast. Be ready and stay calm. If I come out slow, be patient and wait for my call. I need more time to find my way. When I'm little lost, please lead the way. I have full potential for growth when all connections are turned on. I deserve to be born healthy and complete without numbness and grogginess. Good beginnings is my birthright. Will you promise to be kind? Yeah. Thank you, everyone. I hope you enjoyed the session. And next week, you are welcome to come back for our next week's session. It's about postnatal care and baby's future health. Yeah, it's all about baby. Have a good night, everyone.
Good night.
Yeah, I hope you learned something. And
Yes.
yeah, thank you for all our experts today. I'll see you again next week.
Good night.
Welcome.
Bye-bye.
Bye for now. Bye.